Every single day, you are doing 6 things that are making your sciatica worse. Not occasionally, not sometimes, every single day. And if your sciatica has been getting worse instead of better, if you have been doing everything you have been told to do, and the pain has continued to progress rather than resolve, then I need you to hear something that changes everything. The reason your sciatica is worsening has nothing to do with your treatments failing. It has nothing to do with your disc being too damaged. It has nothing to do with your age or your body being beyond repair. It has everything to do with 6 specific daily habits that are actively damaging your sciatic nerve every single day. Habits that are undoing every treatment you try before it has a chance to work. And the most devastating part is not that these 6 things are harmful. It is that most of them feel completely harmless. Some of them feel helpful. Some of them are things your doctor told you to do. Some of them are things you do automatically without thinking because they have become so deeply habitual that the idea of them being the source of your worsening pain has never crossed your mind. I am Dr. Ryan Mitchell, and today I am going to name all 6. I am going to show you exactly what each one does to your sciatic nerve at a biological and mechanical level. And I am going to give you the precise correction for each one so that starting tomorrow, your daily habits are working for your recovery instead of silently destroying it. Before you try one more treatment, take one more supplement, or attend one more therapy session, watch this video completely, because no treatment works inside a daily environment that is undoing it in real time. Fix the environment first. And today, that is exactly what we are doing. Right now, before we go any further, drop your age and your city in the comments below. Just those 2 things. I personally read every single comment on this channel, and I want to know exactly who is watching this video today. Age and city, drop it right now before you forget. Now let me walk you through all 6 mistakes one by one with the exact mechanism of damage and the exact correction for each. And I want you to listen honestly as I describe each one, because the patients who get the most from this video are the ones who recognize themselves in these descriptions rather than assuming each one applies to someone else. The first mistake is sitting for extended periods without positional breaks. And before you tell me that you already know sitting is bad for sciatica, I want to be specific about the mechanism, because understanding exactly what happens inside your tissue during prolonged sitting is what makes the correction feel genuinely urgent rather than like general advice you have heard before and half followed. When you sit for more than 20 to 25 consecutive minutes, the intradiscal pressure in your lower lumbar discs reaches a sustained level that begins to impair the fluid exchange mechanism that keeps your discs nourished and healthy. Your lumbar discs have no direct blood supply. They receive their nutrition through a process called imbibition, where fluid containing oxygen and nutrients is drawn into the disc during periods of low pressure and movement, and fluid containing waste products is expelled during periods of higher pressure. When you sit continuously for extended periods, you maintain constant elevated disc pressure that prevents this fluid exchange from occurring. The disc tissue becomes progressively more hypoxic, oxygen deprived, and the metabolic waste products that accumulate in the disc tissue during sustained loading create a local acidic environment that directly sensitizes the nerve fibers in the outer disc and the nerve roots adjacent to it. This is not a theoretical mechanism. It is the measurable biochemical explanation for why your sciatic pain builds and worsens throughout periods of prolonged sitting. The correction is not to stop sitting. It is to break sitting into segments of no more than 20 to 25 minutes with a brief positional change between each segment, standing for 60 to 90 seconds, taking 3 to 4 slow steps, or performing a single gentle hip flexor stretch between sitting segments is sufficient to restore the fluid exchange mechanism and prevent the hypoxic disc acidification that sustained sitting produces. Set a timer if needed. 25 minutes seated, 60 seconds standing, return, repeat. This single correction applied consistently throughout your day changes the disc environment from one of progressive acidification and nerve sensitization to one of sustained nutritional exchange and tissue recovery. The second mistake is stretching the sciatic nerve directly when it is acutely inflamed. This is the mistake that most surprises my patients when I describe it, because the instinct to stretch a painful nerve seems so logical and so universally recommended. And I want to be nuanced here. Nerve mobilization and nerve gliding exercises are genuinely valuable for sciatica rehabilitation when performed at the right time and in the right way. But there is a critical distinction between nerve gliding, which moves the nerve gently through its tissue sleeve without placing it under tension, and nerve stretching, which places the nerve under longitudinal tension while it is already inflamed and sensitized. When an inflamed sciatic nerve is placed under direct longitudinal tension, as happens during straight leg raises performed aggressively, during certain hamstring stretches that also tension the nerve, and during forward bending that simultaneously loads the disc and tensions the nerve, the mechanical stress on the already irritated nerve tissue increases the local inflammatory response rather than reducing it. The nerve does not want to be pulled when it is on fire. It wants to be moved gently through a range that does not provoke tensile stress. The correction is to replace direct nerve tension exercises with nerve flossing movements, where one end of the nerve is slackened while the other is gently mobilized, alternating the slack end so the nerve moves without ever being placed under net longitudinal tension. If you are performing stretches that provoke your sciatic pain during the stretch, or worsen your symptoms in the hours following, stop immediately. Pain during nerve mobilization is not productive discomfort. It is your nerve telling you the mechanical stress is exceeding its current tolerance. The third mistake is applying heat to an acutely inflamed area. Heat feels wonderful on a painful back. It provides immediate comfort, reduces muscle guarding, and creates a genuine short-term reduction in pain perception through the thermoreceptor gate mechanism. And for muscle tension and joint stiffness that is not driven by acute inflammation, heat is genuinely appropriate. But for sciatic nerve pain driven by acute nerve root inflammation, which is the primary driver of most sciatica flare-ups, heat does something that worsens the underlying problem even as it temporarily improves the pain sensation. Heat increases local blood flow and tissue metabolism in the heated area. In acutely inflamed tissue, increased blood flow brings more inflammatory mediators to the area, accelerates the local inflammatory process, and increases tissue swelling around the nerve root. The temporary pain relief from the thermoreceptor gating effect lasts 20 to 30 minutes. The worsened inflammation from the increased blood flow and metabolic acceleration persists for hours. Most patients who apply heat to an acute sciatic flare notice temporary relief, followed by a return of pain that is more intense than before they applied the heat. And they attribute this worsening to movement or position rather than to the heat application that caused it. The correction during acute flare periods is cold application, ice or a cold pack wrapped in a thin cloth applied for 15 minutes at a time to the lower back and buttock area. Cold reduces local blood flow, decreases the metabolic activity that drives inflammatory mediator production, reduces tissue swelling around the nerve root, and provides genuine anti-inflammatory benefit rather than temporary sensory masking. Once the acute inflammatory phase has resolved, typically after 72 to 96 hours, heat becomes appropriate and genuinely beneficial for the muscle tension and joint stiffness that accompanies the post-inflammatory phase. The fourth mistake is poor hydration. And I want to address this specifically because most people have heard that hydration matters generally for health, but have never had the mechanism explained in terms that make it feel specifically and urgently relevant to their sciatica. Your lumbar intervertebral discs are approximately 70 to 80% water by composition. The nucleus pulposus, the gel-like center of each disc that provides the cushioning and shock-absorbing function is a hydrophilic structure that actively draws water into itself when systemic hydration is adequate and loses water content when systemic hydration is insufficient. Every millimeter of disc height that is lost to dehydration is a millimeter of reduced cushioning between your vertebrae, a millimeter of reduced disc height that brings the two vertebral surfaces closer together, narrows the foramen through which your nerve roots exit, and increases the compressive load on those nerve roots. Research has shown that disc height decreases measurably throughout the day simply from the compressive loading of upright activity, and that adequate hydration is one of the primary factors determining how much of that disc height is restored during overnight rest when spinal loading is reduced. Chronic mild dehydration, the kind that most people live with because they rely on thirst as their hydration guide rather than proactive fluid intake, produces a cumulative, progressive disc dehydration that contributes meaningfully to the nerve root compression that drives sciatica pain. The correction is specific and simple. A minimum of 2 liters of water daily, consumed consistently throughout the day, rather than in large amounts at mealtimes. The first glass consumed immediately upon waking before coffee, before anything else, because overnight fasting produces the most significant dehydration of the 24-hour cycle, and restoring hydration at the beginning of the day maximizes disc rehydration during the morning hours of lower spinal loading. The fifth mistake is sleeping on a mattress that is either too soft or too old. This mistake is one that most sciatica patients have never had explained to them in specific mechanical terms, and it is one that operates silently for 8 hours every single night, either supporting your lumbar spine in its natural alignment or allowing it to sag into positions that load your nerve roots continuously throughout your sleep. A mattress that is too soft, or a mattress that has developed visible or palpable sagging from age and use, allows your hips to sink below the level of your lumbar spine during side sleeping, creating a lateral spinal curve that places asymmetric compressive load on the facet joints and disc on the lower side, and tensile stress on the nerve roots on the upper side. This load is sustained for the full duration of sleep, 6 to 8 hours of continuous nerve root stress occurring during the biological window when your body is supposed to be performing its overnight tissue repair and inflammatory resolution. The correction is a mattress with sufficient firmness to keep your hips and shoulders at the same horizontal level during side sleeping, maintaining a straight lateral spinal alignment rather than allowing the hip to drop. Medium firm is the evidence-supported recommendation for most back and nerve pain patients. If your current mattress is more than 7 to 8 years old or shows any visible sagging, a folded firm blanket or a 3/4-inch plywood board placed under the mattress in the hip region can provide temporary mechanical correction while a mattress replacement is arranged. The sixth mistake, and this is the one that surprises my patients most consistently, is breath holding and shallow breathing during pain episodes. When sciatica pain spikes during that electric shock of standing up, during the first steps after prolonged sitting, during movements that catch the nerve, the automatic physiological response is to brace, tense, and hold the breath. This breath-holding, bracing response feels protective. It feels like you are stabilizing against the pain. But what it actually does is dramatically increase intra-abdominal pressure, which in turn increases intradiscal pressure, which compresses the nerve root further, which amplifies the very pain signal you are trying to protect against. The tensing of the surrounding musculature during breath holding also creates a reflexive muscle guarding pattern that maintains compressive pressure on the nerve root long after the provocative movement has ended, extending the duration of each pain episode significantly beyond what the initial mechanical provocation alone would produce. The correction is deliberate, slow, diaphragmatic breathing during pain episodes. A long, slow inhale through the nose that expands the belly rather than the chest, followed by a slow, controlled exhale through pursed lips. This breathing pattern reduces intra-abdominal pressure, inhibits the reflexive muscle guarding response, activates the parasympathetic nervous system, which reduces pain signal amplification and shortens the duration of each pain episode measurably. It requires practice because the breath-holding bracing response is deeply automatic, but within 1 to 2 weeks of deliberate application during every pain episode, the new breathing response begins to replace the old bracing response automatically. Now, I want to tell you about Lucas. He is 55 years old, a project manager from Illinois who had been dealing with right-sided sciatica for 2 years when he first came to see me. Lucas was a thorough and organized person. He had kept a detailed log of his pain levels, his treatments, and his daily activities for the previous 8 months, trying to identify patterns and make sense of why his sciatica kept worsening despite the treatments he was receiving. When he showed me that log, I could see all 6 mistakes written into his daily routine with remarkable clarity. He was sitting for 3 to 4 consecutive hours during his work-from-home schedule without positional breaks. He was performing aggressive straight leg raises twice daily because a previous therapist had recommended them. He was applying a heating pad to his lower back every evening for pain relief. He was drinking approximately 1 liter of water daily, less than half of what his disc tissue needed. His mattress was 11 years old with visible sagging on his side, and his pain diary recorded multiple times daily the phrase, "braced and waited for it to pass." The breath-holding guarding response described in exact language without him realizing what it represented mechanically. I did not change his treatment. I changed his environment. I gave him a 25-minute sitting timer. I replaced his straight leg raises with nerve flossing movements. I switched his heat pack to ice for flare periods. I prescribed 2 liters of water daily, starting with a full glass immediately on waking. I recommended a medium-firm mattress topper for his aging mattress. And I taught him the diaphragmatic breathing response for pain episodes and asked him to practice it deliberately 10 times daily until it became automatic. At the 2-week mark, Lucas sent me his updated pain log. His average daily pain rating had dropped from a 6 to a 3. At the 4-week mark, he came back for a follow-up appointment and told me something that I find deeply meaningful every time a patient says it. He said, "Dr. Mitchell, nothing about my disc changed. Nothing about my nerve changed. The only thing that changed was what I do every day, and my pain is half of what it was." That is exactly right. The disc did not change. The nerve did not change. The daily environment that the disc and nerve were living in changed, and the pain responded to the environment. Lucas continued applying all 6 corrections consistently. At the 3-month mark, he rated his average daily pain at a 1. He said he could not remember the last time sciatica had stopped him from doing something he wanted to do. Here is your 6 correction summary. Break sitting into maximum 25-minute segments with 60-second positional breaks. Replace direct nerve tension stretches with nerve flossing movements that mobilize without tensioning. Use cold, not heat, during acute flare periods. Drink a minimum of 2 liters of water daily, starting with a full glass on waking. Address mattress sagging that is allowing your hips to drop during side sleeping. And practice slow diaphragmatic breathing during every pain episode to break the breath-holding guarding cycle. 6 corrections, none of them requiring a prescription. None of them requiring an appointment, all of them starting today. Right now, this is your final reminder. Scroll down to the comments and leave your age and your city. Tell me which of the 6 mistakes you recognize yourself in most strongly. Which one surprised you most? I read every single comment personally, and I respond to as many as I possibly can. Lucas went from a 6 to a 1 in 3 months from 6 corrections to his daily environment. Your environment changes today. I am Dr. Ryan Mitchell, and I will see you in the next video.